everyone, and welcome to Asian Viewpoints with marysit. If you were the parents of a newborn with lung disease, you would want your baby to be treated by my next guest. Dr. Leland Fan has worked for more than 4 decades as a pulmonary lung disease physician. His illustrious career has included serving on many international medical boards, teaching as professor of pediatrics at Baylor College of Medicine and the University of Colorado School of Medicine. And he's garnered dozens of prestigious awards, including being listed on lists we would recognize: Best Doctors, America's Top Doctors, and U.S. News Top Doctors. Leland, thank you so much for being with us.
Thank you for having me.
Before we get started, full disclosure, you and I are cousins. Our mothers were sisters. Dr. Joyce Fan, your mom, and my mom, Amy Sit, were sisters. So, Leland, how did you decide to specialize in pediatric pulmonary disease?
So I guess as far as I could always remember, I wanted to be a doctor. I think my parents planted that in my brain from the time I was a toddler, and I never questioned it. So that's how I ended up being a doctor. And then during my training residency, I had some mentors that were pediatric pulmonologists,
Uh-huh.
and I really liked the way that they practiced medicine, and so I wanted to do that. Also, in medical school, I worked as a pulmonary function technician under an adult pulmonologist a couple of summers, and so I also developed an interest there.
Over 4 decades, the field has seen many, many changes. While you were practicing, you actually worked hard to change the way certain conditions were diagnosed and treated. Can you talk a little bit about that in layman terms?
Sure. So the second half of my career, um, I had moved to a place called National Jewish, and it was a center of excellence, or kind of a referral of last resort. And they took very complicated patients.
Mhm.
Prior to that time, I had been mainly an ICU and hospital-based physician. So when I moved to National Jewish, I had to kind of reinvent myself.
Mhm.
And so I looked around to see what I could do. And there was a very famous adult pulmonary group that specialized in rare adult lung diseases, known as interstitial lung diseases. So I started hanging out with them, and I realized, well, maybe I can do this in children on a smaller scale.
Mhm.
And at that time, these rare lung diseases, not very much was known about them.
Uh-huh.
So there were just a few case reports of this condition or that condition, and not much known about the collective group of them, of which there were over 100 different conditions. So I organized my thinking around approaches to diagnosis. In other words, what tests would be needed to diagnose a specific condition?
Does that mean the baby had to go through a lot of different tests to figure out what was wrong with him or her?
Um, Yes, potentially a lot of different tests. And
Okay.
some of them were quite invasive. So, kind of the original gold standard for diagnosis of many of these conditions is something called an open lung biopsy.
Mhm.
And so, therefore, um, the patient required undergoing an operation to make a small incision in the chest and take a small piece of lung out, and then run a bunch of tests on that lung tissue to see if we could figure out what type of condition it was.
Leland, did you get much pushback in your career when you tried to change conventional thinking in the way you diagnose or the way you treat certain conditions? Because really, you decided, no, I think we should do this instead of that. What kind of feedback or pushback did you get from your colleagues?
Nobody in my field was that interested in these conditions.
Okay.
But I went to the basement and pulled 50 charts of these conditions over the previous 12 years and filled out a database to find out what types of conditions they were and what it took to diagnose them. So I actually was accepted um, in this field because people were interested in knowing and understanding what these conditions were and how you would approach them and how you would treat them.
Leland, you've published numerous peer-reviewed articles. You've served on all these international medical boards. You've gotten a lot of awards in your field. To you, what do you feel is your greatest accomplishment career-wise?
I'm really not that competitive,
Okay.
and um, the awards, all of that stuff, it just wasn't that important to me.
Okay.
But taking care of patients um, and trying to answer the questions of the day, those things were important to me. And whether I got any credit for it or not, it really didn't matter. So the greatest satisfaction that I've gotten in my career is getting calls from uh, parents of former patients and saying, well, you don't remember me, but, or getting an email like that. And that has been the most rewarding thing, I think.
What advice would you give to medical students today?
Things have changed for new doctors, and they will not be able to enjoy the kind of career I had because the kind of career I had, I was given time to see the
Mm.
patients. Um, I wasn't rushed. Some of these rare lung disease patients, I would schedule an appointment, block off my entire morning, and see them
Wow.
for 4 hours or more. And it would take me at least that much time to review their records. So nobody in the current era has that kind of time
Mhm.
to see the patients for that long. They get pushback from the administration that you can't make enough money doing it that way. So unfortunately, the new doctors, they have much more pressure to see more and more patients with less and less time. And I feel bad for them because, they have to practice a different kind of medicine. So for them, I would say find something that you're really passionate about and do that. And to the best of your ability, with the constraints of time that you have. And I encouraged all my fellows to pursue a career in academic medicine because in that, even now, you can um, ask the questions of the day, pursue research, see patients, and teach medical students, residents, and fellows. And I think that's the most rewarding type of career still.
You are now retired. How many years have you been retired?
Slightly more than 10,
Okay. And you also have how many grandchildren?
12.
Okay. Wow. Congratulations.
Oh, thanks.
So, but you are not just a couch potato. You are out on those ski slopes in Colorado. You now live in Denver. Tell me about that skiing. I think it's incredible at your age. Can I tell how old you are? Is it okay?
Sure, I'm 76.
And you're on the ski slopes and not the bunny slopes. So tell me about how you keep that up and how you make retirement fulfilling and purposeful.
Well, so let me tell you how I learned
Okay.
because, I grew up in Texas.
Right.
I didn't know what a ski slope was, but I trained, these are my mentors in my fellowship. They were both dynamite skiers. And one of the reasons why you took the fellowship, even though you had to work hard, take that night call every night for a month, um, you got to go skiing too. So, my mentors had a philosophy, work hard, play hard. And I adopted that. And so one of my mentors, he said, well, I'll teach you how to ski. So he took me to the top of Vail Mountain and he left me.
Oh my goodness.
And so, and I got down and I did ultimately learn how to ski, but that's the way he taught me.
And you were
So
an adult then, right? By the time
I
you
was
went to that
30. If I had
30 years old,
learned,
you learned how to
if I
ski.
had learned when I was 10, I would be really good now. But, I'm okay, but I ski like somebody who learned how to ski when they were 30.
Well,
So,
I'm pretty
but
impressed with your
because they had a passion for skiing,
mm.
I developed a passion for skiing. And so, I emulated them. And so I've skied, every year since then. and maybe I'm a little better than that now. So, but I really enjoy it. It's one of the major things that I do since I've retired. Ride my bike in the summer, ski in the winter, and work out a little bit more in the summer to get in shape for ski season.
That's great. Well, Leland, thank you so much for the interview, and enjoy the
Thank
ski
you.
slopes.
Thank you. I've enjoyed it very much. Thank you.
If you liked this interview, please click the like button below and be sure to subscribe to this channel so you never miss an edition. Thanks for watching. I'm Mary Sis, and I'll see you again in the next video.